Good afternoon, everyone. Thank you for joining us today to discuss a very important topic, chronic mental health issue in Malaysia. I'm MC Marul, and I will be guiding you through today's discussion. Mental health is a critical issue that affects many people in our community. And today we aim to raise awareness, provide information, and share personal experience to help those affected. We are honored to have two special guests with us today. First, we have Head Officer Amy, a health advisor with extensive experience in mental health. That she will provide valuable insight into the topic. Second, we have a patient, Akil, who will bravely share their personal journey with mental health challenge. Let's begin by giving a warm welcome to her officer, Amy, who will provide an overview of a chronic mental health issue in Malaysia.
Thank you, Marul. Chronic mental health issues are indeed a growing concern in Malaysia. According to recent studies, the prevalence of mental health disorders has been increasing steadily over the past few years. For instance, it is estimated that about 1 in 3 Malaysians will experience some form of mental health issues in their lifetime. The most common conditions including depression, anxiety, and bipolar disorder. Depression is particularly widespread, affecting individuals of all ages and backgrounds. It often goes undiagnosed and untreated due to stigma and lack of awareness. Anxiety disorders, including generalized anxiety disorder and panic disorder, are also prevalent and can significantly impact a person's daily life. Bipolar disorder, characterized by extreme mood swings, is another serious condition that requires ongoing management. The impact of these conditions extends beyond the individuals, affecting their families, workplaces, and the broader community. It's essential to understand the signs and symptoms of these disorders and seek help when needed. Early interventions and proper treatment can make a significant difference in the lives of those affected. In Malaysia, the government has taken steps to address mental health issues through initiatives such as the National Mental Health Policy, which aims to promote mental health awareness and provide accessible mental health services. However, there is still much work to be done in terms of reducing stigma and ensure that individuals receive the support they need.
Thank you, Amy, for that informative overview. Now let's hear from Akil, who will share their personal experience with chronic mental health issues. Hearing personal stories can help us better understand the challenge faced by individuals and the importance of support and treatment.
Thank you for having me. My name is Muhammad SYAQIL and I've been living with depression for past 3 years. My journey with mental health challenge began with when I was in college. At first, I didn't understand what happened to me. I felt an overwhelming sense of sadness and hopelessness that I could not shake off. One of the biggest challenges I faced was dealing with the stigma surrounding mental health. Many people around me didn't understand what I was going through and often dismissed my feeling. This made it difficult for me to seek help and talk about my struggle. However, I eventually reached out to a mental health professional who diagnosed me with depression. Through therapy and medication, I learned to manage my condition. I also found support in my friends and family who start to understand and support me. Coping with depression is an ongoing process, but I've learned to recognize my trigger and develop healthy coping strategies. For example, I found that regular exercise, mindfulness practice, and maintaining a routine help me manage my symptoms. It's also important to have a strong support system and to communicate openly with those around you. I hope that by my sharing my story, I can encourage others to seek help and know that they are not alone. Mental health is just as important as physical health, and it's essential to take care of both. Thank you for listening.
Thank you, Akil, for sharing your powerful story. Now let's dive deeper into the discussion. Amy, can you tell us more about the support available for individuals with chronic mental health issue in Malaysia?
Certainly, there are various resources available for those seeking help. The Ministry of Health Malaysia offers mental health services through public hospitals and clinics. These services include counseling, psychiatric assessments, and treatment options. Additionally, there are numerous non-governmental organizations (NGOs) that provide support, such as Befrienders, Malaysian Mental Health Association (MMHA), and Mental Illness Awareness and Support Association (MIASA). Many of these organizations offer helplines, online support groups, and community-based programs to provide assistance to those in need. It's important for individuals to know that help is available and that seeking support is a crucial step towards recovery. Furthermore, raising awareness and reducing stigma are key factors in encouraging more people to seek help.
Akil, what advice would you give to others who are going through similar experience?
My advice would be to reach out for help and not to suffer in silence. It's important to talk to someone you trust and seek professional support. Educate yourself about your condition and find coping strategies that work for you. Remember, it's okay to have ask for help, and there is no shame in seeking treatment. Building a support network and staying connected with loved one can make a significant difference in managing mental health challenge.
Thank you for those valuable insights. Now let's take a break about a few minutes. For the audience, you can make a question for the Q&A session. If you have any question, please feel free to ask. Now let's start to our question number one. What are some early warning signs of the chronic mental health issues?
Early warning signs of chronic mental health issues can vary, but common indicators include persistent sadness or depression, excessive worry or anxiety, changes in sleep or appetite, withdrawal from social activities, and difficulty concentrating. It's important to pay attention to these signs and seek help if they persist.
Question number two. How can we support a friend or family member who is struggling with a mental health issues?
Supporting someone with a mental health issue involves being understanding, patient, and non judgmental. Furthermore, encourage them to seek professional help and offer to accompany them to appointments if they are comfortable with it. Lastly, listening without offering unsolicited advice and showing empathy can make a significant difference.
From my experience, having a supportive friend or family member can be incredibly helpful. Sometimes, just knowing that someone cares and is there to listen can be comforting. Small gesture like checking in regularly and reminding them that they are not alone can mean a lot.
One common misconception is that mental health issues are a sign of weakness or that they can be overcome through willpower alone. Another misconception is that seeking help for mental health issues is something to be ashamed of. It's important to understand that mental health conditions are medical conditions that require proper treatment and support.
Question number 4. How can workplace better support employees with mental health challenges?
Workplaces can support employees by fostering a culture of openness and understanding regarding mental health. This includes providing access to mental health resources, offering flexible work arrangements, and implementing employee assistance programs. Training managers to recognize signs of mental health issues and respond appropriately is also crucial.
Question number 5. What coping strategies can individuals use to manage chronic mental health conditions?
There are several coping strategies that can be effective, such as practicing mindfulness and meditation, engaging in regular physical activity, maintaining a balanced diet, and getting adequate sleep. It's also helpful to establish a routine, set achievement goals, and stay connected with loved ones. Finding hobbies and activities that bring joy and relaxation can also make a big difference.
Question number 6. Can you share any success stories or positive outcome of individuals who searching help for their mental health issues?
Absolutely. There have been many cases where individuals who sought help for their mental health issues experienced significant improvement in their quality of life. With proper treatment, such as therapy and medication, many people are able to manage their conditions effectively and lead fulfilling lives. Early intervention and continuous support are key factors in this success story.
I can share my own story as a testament to the importance of seeking help. After receiving treatment and support, I've been able to manage my depression and lead a more balanced and fulfilling life. It's a journey, but with the right support and resources, recovery is possible.
Lastly, what steps can the community take to reduce the stigma associated with mental health issues?
Reducing stigma involves increasing awareness and education about mental health issues. Community programs, workshops, and campaigns can help dispel myths and promote understanding. Encouraging open conversations about mental health and sharing personal stories can also help normalize seeking help and reduce stigma.
Sharing personal experience and educating others about mental health has been instrumental in my journey. When people understand that mental health issues are common and treatable, it helps reduce the stigma. Being an advocate and speaking openly about mental health can inspire others to do the same thing.
We have had a very insightful discussion today, and I hope it has provided valuable information and support to those who need it. Chronic mental health issues are a critical concern, and it's important for us to continue raising awareness and providing support to those affected. I would like to extend my heartfelt thanks to Amy, Head Officer, and the patient, Akil, for sharing their knowledge and experience. Thank you to everyone for participating and for your thoughtful questions. Let's continue to support one another and work towards a healthier and more understanding community. If anyone here needs support or knows someone who does, please do not hesitate to reach out to the available mental health resources. Remember, seeking help is a sign of strength, not weakness. Have a great day and take care of your mental health.